Well, let's start in our normal tradition. Testing 1.
Testing 2.
Testing 3.
Testing 4.
He's got it.
He's got it.
Yeah,
Brilliant.
Yeah, absolutely fantastic.
Ladies and gents, welcome to the Testing Podcast. We're here tackling fertility together, talking all things fertility, and we've got a wonderful guest on today, Dr. Steven Moser. What a legend you are, and the guy that changed my life. I can't wait to get stuck into this today.
We've been waiting a long time to get this one in the can, haven't we? Because it's a really important part of your journey, your story.
Yeah.
And just a really important part of the whole of the male fertility kind of scenario. So I think we've got to kick off, Stephen, with the question of your title and what that means, because it's a title that we'll band around and say to people, oh, go and see an interventional radiologist. Most people, what the hell is that?
What's that?
so do you want to kind of dispel what that is first?
Yeah, absolutely. So absolute delight to be here.
Brilliant.
Been waiting a while.
Mm-hmm.
Difficult to get our
Diaries.
Venn diagrams to overlap sometimes, isn't it?
Absolutely.
But delight to be here. So yes, I am an interventional radiologist. So a lot of syllables, basically to say I do plumbing. What does it actually mean? So I did radiology, which is the study of all things imaging, be it X-ray, ultrasound, CT, MRI, and then you do an extra fellowship where you learn to do operations. And the beauty of these operations is that you make no cuts. So you work through needle holes and using, again, ultrasound, X-ray, all these various imaging modalities. And for this, you use a very fancy machine called an angio machine, where you do angiography, look at blood vessels, or anyway, tubes. And so you train in that, and you learn how to do operations using these different methods.
Makes it sound so easy.
It
Yes.
does.
Let's go and get a little book now and work out how to do it. I mean,
Yeah.
this is major stuff, isn't it? It's kind of, obviously you've been doing this for many years, haven't you? But
I have, yes.
Seems like quite
over
advanced.
20 years now, yes.
quite advanced medicine. Was the imaging available, 20 years ago? How was it? How does it kind of differ now compared to when you started 20 years ago?
It was far more rudimentary, no doubt.
Yeah.
So about 30, 40 years ago, there was pretty much none of this at all. Maybe somebody stuck a needle into some part of the body and took an X-ray to see where that needle was by injecting some contrast medicine. And it's just moved on. It's one of the quickest growing areas in medicine, but certainly in radiology.
Fascinating. And it's not just, because we're going to talk varicocele today, which is such a huge subject in terms of the male fertility space, but that's not all that you do, is it? It's not like you only do interventional radiology and only deal with varicoceles. There's a whole other area that you work in. Is that right?
So apart from operations, so using needles or wires and all the rest of it, I do reporting of all kinds of scans, CT scans, MRIs. I do lots of ultrasounds. I look at plain films. I do all the normal things that you'd expect a radiologist to do. And as well as that, I do these operations. And a small portion of what I do is the treatment of varicoceles. So I treat lots of surgical medical emergencies. So if someone is bleeding, say if they're vomiting up blood, that means they've burst a blood vessel somewhere in their upper gut, maybe their esophagus, stomach, duodenum, anyway. And I find that bleeding point and I block
Block it, plumb it.
stop the bleeding.
Stick a cork in it.
Yeah.
Yeah,
Yeah.
essentially. So I do that by placing a tiny coil perhaps or some little particles which just block the vessel. And the huge advantage of that is I've done it all through a needle hole. No cut. The patient recovers from a needle hole rather than a major operation where they've had to cut the stomach open, find a bleeding point, and cut it out or stitch it over.
So it has been really transformational then, isn't it? Really, this imagery in sort of being able to manage multiple conditions, I
Yes.
should say.
It's
and,
really interesting. So I might, if somebody is bleeding, if they're losing blood, I stop that. If somebody, for instance, can't walk because their legs aren't getting enough blood, I open the blood flow.
Mm-hmm.
So to improve blood flow,
Yeah.
or if someone's losing their kidney,
Mm-hmm.
because the kidney's artery is narrowing up,
Mm-hmm.
is furred up or is blocked, I can open that.
Mm-hmm.
But also function. So if someone's liver, you may have been or seen people who have been jaundiced, yellow jaundiced.
Yeah.
That's because the liver is blocked
Mm-hmm.
in its releasing of bile.
Mm-hmm.
So I unblock that and allow it to drain.
It's amazing.
It's amazing.
Absolutely.
It is amazing. You know,
Yeah.
I know a couple of years ago I had a condition called Wolff-Parkinson-White syndrome, and I remember having an ablation and talking to my cardiologist about what they were going to do, and I just found it absolutely amazing that the cardiologist was saying, "Well, we'll make an incision, a small incision in your groin, and we'll feed wires through to your heart." And I was going, how on earth are you going to manage
How'd
to
you get
do
that?
that from your groin into your heart? But I suggest that it was probably about similar type
It is identical. So I
type of
don't
surgery.
work on brains. The neuroradiologists
Uh-huh.
and neurosurgeons do that. And I don't work on hearts. The cardiologists do that.
Mm-hmm.
But we all do it from pretty much the same place. And we could easily, in fact, all of these things started in radiology. So
Yeah.
radiologists used to do all of the heart work.
Yeah, yeah.
and
It's
then
amazing,
became
isn't it?
specialised
It's amazing
to the
rather than open
cardiologists.
heart surgery that you can get through the groin and through the main blood vessels and then sort out issues and cardio mapping and all the
Yes.
imagery that you would use to work out what's going on, and then being able to pinpoint and actually correct it. And it's been transformational for me, but you know,
It's been
and
transformational
been-
for both of you.
Yeah, exactly.
Yeah.
So no,
Yeah, absolutely.
you know, absolutely bow down to the
Yeah.
profession.
And on the
It's
other side of it,
unbelievable.
transformational for me too.
Yeah.
It's given me a wonderful life
Mm-hmm.
Yeah.
with lots of challenges and sometimes some really scary moments. People bleeding out, and you think, "Got to stop this bleeding."
That must be so
They're
stressful.
going to die.
Yeah.
So we've had some, just another anecdote really, but with no detail. After a delivery, a mother can start bleeding, and you're expecting the joy of the birth of a baby in a normal part of life rather than an illness. And then within minutes, a mother can bleed to death. And those are probably some of the most stressful of these procedures, because you have a father cradling a baby thinking he's about to lose his wife
Yeah.
and the mother of his child, and you're battling to stop the bleeding.
Yeah.
For me, that's probably one of the most
That's most stressful
That sounds
areas
stressful.
of medicine, isn't
But
it?
when
yeah.
it works,
Yeah.
and I will say I've never lost one of those on my watch, 20 plus years. I've never.
wow.
Congratulations.
But
That's amazing.
every
isn't it?
single time you think,
It's a worry. It must be a worry, mustn't it?
what are we going to do?
Yeah.
And how do you come down after that? Like,
Yeah.
you know, how do you, like you finish your op, you can go and scrub out and clean up, and what do you do,
Go home.
what do you
cook
do
dinner.
then? We go and cook pizzas. We know you like your pizzas,
Yeah.
but how do you?
Go on to the next case. You've
Right.
got to
Just move
just
on.
be focused.
Amazing. We were talking just
Machine-like.
before this podcast that obviously treating varicoceles, you're effectively cooling down testicles, and we were kind of joking that we might call you the firefighter because you're fighting the fire of the testicle. But genuinely, I think Iceman's probably
Iceman or
Iceman.
the human
cool.
plumber?
Yeah,
Yeah.
It's amazing how calm and collected you are just telling that story. But in that moment, you've got to be so chilled to be able to.
You have
deal
to be
with that.
very, very calm.
Yeah.
Very calm, and you set the mood in the theatre.
Mm.
So if you're throwing things around, getting agitated, the whole team gets agitated.
Yeah.
As it happens, I'm a very calm person. I mean, even if I'm just burning up inside, very few people can read my face. It's pretty blank.
It's
my
not
It's not a
voice.
face you were born with.
I don't raise my voice. I don't shout at people. You won't see sweat dripping off me even at the worst moments.
Wow. And how did you get into all of this? What kind of sparked your interest in kind of radiology?
So interestingly, my desire was to do cardiology, and all of my medical school, extra projects, the different essays, all of them were on cardiology. My elective was on cardiology. I went away to Hong Kong and I did some work with some eminent cardiologists there. my intercalated degree. So when you do medicine, you can take a year out and do a specialist degree, and I did it again in cardiac research. And then I wanted to do interventional cardiology. But when I was applying, I also knew that interventional radiology existed. So I thought, right, let's make a strategic decision here. Let me apply for both, and I'll just accept whichever one comes first.
Let fate decide.
That's the direction of travel. So a lot of
Basically,
thought.
flipped a coin,
Yeah. Thought, prayer, good CVs, and I got my radiology placement. That's many years ago, before the millennium.
Wow.
I got my radiology placement. That came, and then curiously, a few weeks later, I was offered a cardiology placement. But given I'd made the decision before the placements, I thought I'm not
change it
changing.
now.
And also, I'm somebody who, when I give my word, it's really important for me.
Yeah.
So I'd committed to something, and I'd said that's what I was going to do, and I felt that was on a point of principle.
Yeah.
No regrets.
No, I can't see any regrets on his face. If anybody's listening to
I
this
love
on
what
the
I do.
podcast,
Yeah.
He's now smiling. So he hasn't got a blank face. He's now smiling. He's made the right decision.
Brilliant.
Well
And so where did varicocele come into play in terms of your work? Is it a relatively new addition to your work, or has this always been part of the work that you've
I've
done?
always done them. So everything I do, be it my radiology, medicine, at home, you mentioned pizzas, whatever it is that I do.
We'll talk about that in a bit.
I try to do it to the best of my ability. I do a lot of research around whatever it might be. I speak to anybody and everybody who's willing to speak to me, who is a specialist in the area. And then having got the basics, which I do have, I then do these procedures, and then I see how I can better them, how I can keep bettering them. And all of the procedures that I do are exactly the same. And it so happens with varicoceles and their treatment, I've just in tiny little baby steps steadily been trying to improve this, such that the outcomes are better, the side effects and complications less and less. There always are, and we can come on to those in a little bit. And the long-term benefits remain. And that's really, if you like, my mantra for whatever I do. And it's played out with varicoceles, which started out as a tiny part of my practice. But because of my outcomes, it's grown.
It's grown, quite significantly. And I think varicocele repair has changed over time, because there's normally sort of two types of intervention, isn't there? I don't know if you want to describe where the direction of travel is going now.
So let's start with the two options. So one is a surgical option. They make a tiny incision, a little cut at the level of the groin. This is where the blood vessels from the testicle come up and go into the abdomen. They find those blood vessels and they tie them off. That's, I know, a very simplistic way of explaining it.
Yeah. We like simplistic.
We do like simplistic.
In our life, generally, and on the podcast.
Men.
And same with me. So that's one option. The problem there, though, is you need to have a cut, you need to have a proper anesthetic. So there are the issues with recovery, etc.
Yeah.
And then the other option is what I do. And to do this, you also go in at the groin. So you get into a vein, the main vein. You can do it from groin, from arm, from neck, many ways to do this. And we can touch on why you do it from different areas, perhaps. But I do them all now from the groin. And the main reason that I do it from the groin is all of my patients hated having it done from neck.
That concept scares me.
Quite uncomfortable or weird feeling.
Yeah, because you have to have this sterile sheet over your body.
Yeah.
covering your neck, which means part of your face was covered. And if you imagine the procedure is being done from somewhere here,
That's quite scary, isn't it? Anywhere
and
near you.
so you're working above there, going downwards, which means you're working immediately over the individual's ear.
Yeah.
They can hear
It's the
all that
sound
rustling
and movement.
and most
everything.
patients find that quite off-putting.
Yeah.
Whereas at the groin, your face is not covered.
Mm-hmm.
You know, it's far enough away. There's nothing to see because there's a sterile blanket completely covering you. You can touch on this perhaps, Toby,
Yeah.
and because you were on the other side of that. And then you have the procedure done. There's a little sting at the level of the groin where I put the local anesthetic. And then getting into that vessel using ultrasound, and then getting into the varicocele blood vessel using x-rays, and then treat everything from the inside rather than going in from the outside, finding the vessels and tying them off. I go from the inside, I find the main vessel, and then I block it. And it's blocked. There are various ways to block these vessels. You can use medicine, you can use various types of coils, you can use glue, super glue, a medical equivalent, if you like, of super glue.
Yeah.
I use coils, and I use a medicine, and I'll come on to the medicine in a moment. So the coil is placed. If you think about a varicocele as similar to a tree with its roots, if you deal with the trunk, you catch all the roots. So I inject some contrast medicine, and I see where all the blood vessels come together and join up into one or two big vessels. And then I block those or that big vessel using some coils. And again, very specific coils. I use platinum coils, not because they're expensive, though they are, but mainly because you have no problems in future if you're involved in, for instance, a nasty car crash.
And we might come on to that as well.
And you need an MRI scan.
Yeah.
There's no issue with platinum.
And they're pretty
it's not a
inert, aren't
ferrous,
they?
it's
They
an
don't
inert.
have an interaction with the body and so forth.
And also, that's the other point, no known allergies, no known proper anaphylaxis type allergies, various sensitivities. To be honest, I've not even encountered those.
No.
So those are the two reasons to use that.
Can we just go back to before we get into the coils and super glue and whatever else you might put in there, just the physiology of how a varicocele develops and what's going on there? Because I'm listening to this thinking, and I understand varicocele, but I'm thinking, okay, you're blocking off one of the major veins here that, so to control this, it's like, well, is that not detrimental? What's actually going on? So could you explain the whole process
back a
of
little
varicocele?
bit. So your testicles get blood flow from arteries. So the blood goes in through the gonadal or the testicular arteries. And that supplies all the nutrition, the oxygen, all the necessary things to keep the testicle working. And the two main reasons, if you like, for having them is number one, to generate testosterone, which all of us have, women and men, but the balance is different. And the testosterone drives all those male functions, if you like. So that's one reason. You lose your testicles, you lose your testosterone. You damage that blood supply, you damage your testosterone production. And then the second function of the testicles is the production of sperm. And sperm, in the way it's produced, by definition, requires high energy, nutrition, oxygen, high blood flow. And if the blood, in its flowing in, can supply those needs, then the sperm, which are rapidly dividing cells, can grow. Now, if the blood flows in, but it doesn't flow out very well, it's like a dam effect, where you've got blockage of blood flowing out. And I'll explain the problem in a moment. So if that happens, even though the blood can get pushed in, it's not flowing out as efficiently. So there is some reduction to the inflow because eventually it gets dammed up.
Mm-hmm.
Now you want to improve the outflow if there's a problem, or if there's a problem with the inflow, you want to improve that.
Mm-hmm.
So some people genuinely have poor arteries, so the blood isn't flowing as well to the testicles, and then you need to stretch those vessels. It's rare in young people, so it's not really an issue. And as we get older, I suppose the bigger issues in life are to do with cancers, poor circulation to heart, to your other parts of your body, your kidneys, which might fail. And testicle blood flow is sort of quite low down on the agenda there.
Yeah.
However, in younger people, testosterone and fertility, especially testosterone, very important. And then there's a small niche, if you like, group of people where fertility is the issue or infertility is the problem. So that gives some idea of the basics of that plumbing.
Yeah.
Now, coming to varicoceles, 15-20% of us men have a varicocele. It doesn't mean every single one of us who has that has a problem. But just like you see an auntie or an elderly man or woman on the street who's in their shorts, who's got big veins on their legs, those are varicose veins usually.
Yep.
And those veins, for many people, cause no problems.
No issues, no symptoms. Yep.
No symptoms at all. But in a proportion of those people, those varicose veins can cause ulceration on the legs, can break the skin down, can cause nasty staining because of blood leaking. Staining to the skin of pigmentation. And they can hurt, can be very painful.
Yep.
And in the same way, a varicocele, so a varicose vein around the testicle, can cause swelling. The veins get large. And it's often described as being like a bag of worms. You can feel all the lumpy bumpiness of the tubes around the testicle. And the other thing that it can do, as well as the lumpy bumpiness, the swelling, it can cause pain because there's back pressure. These veins are getting stretched and they cause this dull, dragging, nagging ache, often worse on exertion. And I'll ask Toby perhaps to speak on that in a bit. But the other thing, if those veins are dilated, it means the vein that is draining out of the testicle, which is called the gonadal vein or the testicular vein, is not working very well. So all our veins have valves to enable one-way travel. Our veins are all one-way streets. If there's two-way travel, the system doesn't work very well. And occasionally these veins, the testicular vein or the gonadal vein, on either side, the valve becomes incompetent. Now, when that happens, instead of the blood flowing out, it can be pushed in the wrong direction or it can stagnate. And so the blood isn't flowing out very efficiently and there's back pressure.
Back pressure, pooling, reflux. These are all sort of terms that I've heard before. Yeah.
And from a pure flow mechanics point of view, you will realize why it happens more on the left side than the right. So the left gonadal vein drains straight up and joins the kidney's blood vessel or the renal vein on the left at a T junction. So if you think of traffic flow, at a T junction, it's always stop-start. If on top of that, the one-way system, which that T junction, which the blood vessel is traveling towards to reach the T junction, if the one-way system is being disrupted, say like a road in India where I grew up, where traffic is coming in all directions despite a one-way system, where you've got cyclists, you may have the odd cow
on the road. I was just going to think when you're going to say cow on the road, because I've seen lots.
So there's just chaos on the road, which means traffic gets held up. And at a T junction where there is a stop sign, it's stop-start. So the main flow is the kidney's blood flow. And of course, with the chaos of travel, Some people are turning down from the kidney's blood vessel, if you like, the main vessel, down the one-way system,
Going the wrong way.
Yeah, see what's
traveling the
going
wrong
on
way.
down there. Right.
Yeah.
Yeah.
So this is what happens.
Yeah.
In flow dynamics, it seems a very inefficient system, but it is only inefficient when it's not working very well.
Mm.
Now, on the right, the vessel joins, the right gonadal vein joins the main blood vessel called the inferior vena cava, usually.
It's a big one, that one.
Yeah.
That's the big one. Yep.
And it joins that vessel much the same way as a motorway slip road.
I was just thinking, I was thinking inferior vena cava would be like the motorway. It's the,
Yes.
it's the big one, so it's easy for them to get on and get going.
Straight back to the heart.
So there is easy joining there. So 1 in 10 patients will have a varicocele on the right side because the flow dynamics are so much more
efficient.
conducive to efficiency. On the left, 9 out of 10 patients will have it.
Yeah.
Rather than the right. And then there's a small percentage, maybe a 2 to 5%
Which will have
of
both.
people who may have both.
That was me, I think.
Yeah.
Yeah.
Absolutely.
And there are many reasons why you may have both. So, for instance, if you do a lot of, if you already have the propensity, and then you do a lot of cardiovascular work or weights or training or anything where you have rapid changes to abdominal pressure or indeed sustained increased abdominal pressure, so diaphragmatic tensing. I mean, the best example is weights.
I would say like
'cause
deadlift or something like that.
Everybody can understand that.
Yeah,
You've got to
yeah.
tense everything. Tummy's tight.
Yeah.
All your muscles are tensed, and
Putting pressure,
and
isn't
you're
it,
putting pressure.
on your vessels.
So on that, because this comes up quite often, actually, we're often asked about exercise for men and what they should and shouldn't do. And of course, weights are actually very good for boosting testosterone. But if we've got a guy with a confirmed varicocele and he's awaiting embolization and he's got DNA fragmentation confirmed, should he be more cautious about doing weight training?
Varicoceles change very slowly, 1-2 millimeters a decade,
Right.
unless there is a medical problem.
Yep.
So I'll come to your question in just a moment. So the other reason why you can have a varicocele is you could have a tumor in your kidney. And so the blood flow to the kidney is completely disrupted. If the blood flow to the kidney is disrupted, then the blood flow of the vein joining the kidney's blood vessel will also be disrupted. And so you can end up with a left varicocele. Now, these are incredibly rare. All of you men out there who have a varicocele, don't be thinking,
Oh my goodness!
I'm
I've
about to
I looked
lose
at-
my kidney.
Yeah.
I see one of those every 5 or 6 years,
Yeah.
Wow.
if
They're really
even.
rare.
If
Really
even.
rare.
They are very, very rare.
Yeah.
So that's one of the reasons, which is so rare that I want to just put that away now.
Yeah.
Now back to what were you asking me?
Well, just if we've got a guy with a confirmed varicocele, possibly high DNA frags, he's had that diagnosis as well. Should he be more cautious about doing heavy weight training if he's got a confirmed varicocele?
So I like to look at it the other way. Anything that gets in the way of normal life needs to be dealt with. Anything that gets in the way of good health needs to be corrected so that good health can be maintained or indeed improved. So if somebody has a varicocele and it is getting in the way of their exercise regime, their normal day-to-day activities, the issue is not, right, the problem here is my activity. You don't turn then into a couch potato. Your only exercise being, lifting a stubby of beer with one hand and working the remote with the other. No, what you need to do is either manage the symptoms so they don't trouble you of your varicocele, or else have it dealt with so that you can get on with your normal life and stay healthy.
But whilst they're waiting for that, in terms of get it dealt with, is the activity of doing weights and heavy lifting going to exacerbate or worsen the varicocele?
It's going to make your symptoms worse because it's going to hurt.
Yeah.
The worsening of a varicocele being as slow as it is, it's going to make very small incremental changes to your varicocele. So it's going to make those veins bigger with time. I really push hard against saying change how you live.
Change your habits, change your good positive
Yeah.
habits.
Mm.
Yeah.
Because it's very difficult to break bad habits and go back to your good ones.
Yeah.
Yeah, that's
But
a good point.
look, your point is absolutely valid. If you're trying to have a pregnancy and the varicocele is getting worse and you're pushing blood in the wrong direction and it is heating the area because the blood is stagnating there and your DNA fragmentation is getting worse and worse,
Yeah. You've got to change something.
you've got to
haven't you?
change something, be it with various cooling mechanisms, be it with trying to be more less standing. But in real life, who of us can actually
very hard,
do
isn't it,
those
Steve?
things?
It is
Yeah,
very
yeah.
hard. And I just picked up on a word that you mentioned there was the heat. And I think heat is something that we've got to be really mindful of with testicles in particular. And I don't know whether you can expand upon that, but, testicles are outside of the body for a reason, and varicoceles can make things a bit worse because of the core temperature. I don't know what...
So let's go back a little bit. Testicles develop inside your abdomen, inside your pelvis, and then they come down during the later phases of you being in utero.
Yep.
Or they can be en route, if you like, and can come down into the scrotal sac round about the time of birth. And some people, they don't come down. And when they don't come down, that extra heat as you're growing up damages the testicle, so they atrophy, they shrivel. But worse than that, that extra heat damages the testicles and the dividing cells to the point where you can get cancers.
Right.
So it's quite a serious thing, overheating your testicles. Again, don't get caught up with the, oh no, I've got a varicocele, I'm going to get cancer. There isn't. That's not the point I'm making.
That's not the point, no.
No. The point I'm making is the heat damages the testicle. A damaged testicle releases damaged sperm.
Yep.
And releases less testosterone. So there's a good reason why they are outside the body. It's cooler.
It's cooler, yeah. And I think so, like most of the research now, some of the later research has shown that, when looking for a varicocele, I think the traditional method of diagnosing a varicocele was not only being palpable, i.e. you can see it and you can feel it, the sort of tubules being dilated, but almost confirming it by ultrasound. And I think that's actually fine, and it should be treated if you're getting symptoms related to the varicocele, which we just discussed. But fertility and varicocele, often there's quite a bit of a debate between sort of different societies of whether patients should be treated or not, whether there's sufficient evidence to suggest that varicocelectomy or embolization is going to have an impact on fertility. I don't know whether you can expand on that, because I think you've done a lot of work in that area as well, haven't you, in terms of the impact on fertility, not just the symptomatic pain or issues around varicocele.
So we have a huge cohort of patients, and we have very clearly shown by the statistics of analyzing these patients, as opposed to anecdotal occurrences where 3 months, 6 months, 5 months after a varicocele embolization a pregnancy occurs. But we have the data which does show significance that the treating of the varicocele does improve the fertility. But I want to just dial back a little bit here and say that varicoceles are very, very common. As I mentioned, 15-20% so 1 in 5 men will have them. Doesn't mean 1 in 5 men is fertile. Is infertile, sorry. Some may have symptoms with aching. Some may notice the swelling. Some may have infertility, but the vast majority will have nothing. They will just notice, oh, that's a bit lumpy, or not even notice that. So treatment because of a diagnosis is the worst form of medicine in this situation. The treatment should be based on symptoms or signs. By that I mean, what is it doing to you? What are your symptoms? If they are pain, if you're finding it awkward, uncomfortable to have the equivalent of a third testicle because of all the swelling around the testicles. These are reasons to do something about it. If, however, it's not doing anything of any detriment, don't fix what isn't actually broken from a point of view of your normal life. Now, we know the statistics are very clear, even though 15% of men have these. In infertile couples, that goes up to 1 in 3. So there is a clear correlation. Again, that doesn't prove, just because it's higher, that it is the problem. But it's very clear that a varicocele, which raises temperature, affects the protein in that area, and DNA being a fairly fundamental protein, if it breaks down, then you can have a pregnancy, but you reach a certain point in that pregnancy where that bit of DNA is necessary for the forming of an organ, something, during the development of the embryo. And you reach that point, and that segment of DNA is fragmented, so it is non-functional. And you either have a pregnancy which comes to term with that segment, that portion of the body, not present or not working normally.
With an abnormality.
So you have an abnormality, or you have a vital organ that is dependent on that segment of DNA, which doesn't form, and you go through the trauma of a lost pregnancy.
Yeah. And it's quite devastating, isn't it? And I think, recent guidelines from America, from Europe and elsewhere have recognised, I think, the importance of sperm DNA fragmentation on fertility outcomes in a number of different areas. But miscarriages is one of those big ones, which is really, really difficult for patients to manage, because they're obviously getting a pregnancy. But when you're getting these components of the code between the egg and the sperm and the embryo not functioning, it is now thought that sperm DNA fragmentation is a vital component and should be considered if you're getting multiple miscarriages or recurrent pregnancy loss. And I think it's one of those indications, I think, for checking what could be the root cause. And the root cause is not necessarily down to just the embryonic changes and putting a sperm inside an egg through ICSI or through conventional IVF, but it could be fundamentally the ingredients not being quite right right at the beginning, maybe just due to this heat stress that has occurred through the vasculature. So it's something that should be considered, and I think using some of the latest diagnostics can help you in diagnosing whether patients should be treated or not. Is that your view as well?
Yes, very much so. But I mean, it's very easy to say, oh yes, everything stems from this. But we already know 25% of pregnancies are lost during the first few weeks, certainly within the first trimester. And it's just, in most women, considered to be, oh, was that a heavy period? Many don't even realize, don't know. But the fact of the matter is, these are always multifactorial.
Absolutely.
There are multiple contributions. So what are we trying to do in the arena of infertility? We're trying to improve every factor so that the possibility of a viable, healthy pregnancy is increased to as much as is humanly possible.
Which is exactly what we stand for. Optimise the sperm, optimise the egg, and give yourself the best possible chance.
Yeah.
And just, sorry, Toby, itching to come in, but I just want to go back to the data that you've said. You've got a vast cohort of patients. You're seeing that actually fertility rates increase after varicocele treatment. Do you think this data, this research, this understanding of the importance of varicocele is being acknowledged and recognised in the fertility industry enough?
Certainly in the fertility industry, it is now common knowledge. It is known, but for the whole time that infertility has existed, it has always been considered to be a problem with on the maternal side.
Mm.
It's the female problem. She carries the baby, so if she's not carrying one, it's clearly her fault. And we're not even going to go into the paternalistic societies that most of us live in. But the fact of the matter is, you need two hands to clap, and
It's a great way of putting that.
you've got to not just concentrate on one. You've got to concentrate on one and concentrate on the other in two separate areas. So andrology is such an important field, and yet it is such a small field. Most people have never even heard of an andrologist. Everybody has heard of a gynecologist. And that's probably because of deliveries and various other women-related problems. But even so, in infertility, it's still quite germinal, still quite small.
It is, and I think that there is sort of a male sort of protectionist sort of thing about your testicles. You don't talk about it, and it is very private sort of matter. But I think one of the key things that we're trying to sort of dispel. I can never get my words right when I do these sort of things. Is make sure that people are aware, just as women are aware of breast examinations, that men should be doing an examination of their own testicles and saying, is it quite right? And if it's not, then go and see the GP and go and see whether that it needs any type of correction. Certainly if it's symptomatic, as you said earlier on, if there's something not quite right, we've got to go and get checked, haven't we, guys? So it's been brave enough to break that male stigma of your testicles are your crown jewels, but they're yours. Not
They are.
Look after them.
They are. But we should look after them as well.
But this is a really fascinating point that you alluded to a moment ago, which is what women do and what men do. Now, women have no problems discussing, by and large, I'm huge generalization, so apologies for it, but most women have no problems discussing with their friends, their various, I felt maybe a breast lump, or my period's not quite right. What's yours like? Or, what did you do when you had cramp? Did you use... What helped? Can I try some of that? And a really interesting thing, and this is not just about safety in a club, but women have no problems going as a group to the loo together. When's the last time any of us said, turn to your friend in the pub and said, "I'm going for a pee. You coming with me? Come, let's
I had
go
exactly
have a pee."
this the other day. I can't remember who it was.
Brilliant.
It wasn't with you, was it?
It might have been. I don't
But
know.
it's literally, okay, you go first, mate. I'll be a couple of minutes behind you, because we couldn't go to the toilet together. It was just a bit too weird. And it's ridiculous.
And very few men. So really interestingly, I was just last week speaking to a patient who was having a varicocele embolization, and he was telling me, I was chatting to my friend, and I was telling him what I'm going through because I think it's really important, and he said, I'm sure I have the same thing. I've got this aching, and I can feel lumpy bumpiness, and I don't want to speak to anyone about it because it may be a cancer, and I just don't want to know. And he said, "Are you mad?
Yeah.
What if it actually is a cancer? You can have it dealt with instead of just burying your head in the sand." And the only reason and this other gentleman who was his friend who he was speaking to has been stressing over this for months, not doing anything and not saying anything. How many of us are there who are just...
Oh, it's
Good
far
old
more
man.
common.
living in our
everything.
silos like this,
That was me.
and just doing nothing about something that we know is troubling us.
And it's a fear, isn't it? It's a fear of somebody else, having a look at your testicles or your penis or something like that. And it's such a vulnerability that we're brought up with.
But also we're all
privates.
we're all tough, and nothing's wrong with us, and we're invincible. We just can't sometimes acknowledge that perhaps we need a little bit of help.
Yeah.
Not
And
wishing
it's-
to
and it's
go down
absolutely
a
fine.
philosophical route here, but
Yeah.
sometimes
But
this is the
that's-
problem.
That's what we're doing, really. Is that we're trying to provide that help, support, education, awareness, and
Normalise it.
and normalize it. We're if you're born a man, you're going to have testicles and a penis. You need to know what they are and how they function, and more importantly, when they're not functioning well, you may
How
need
to
some help.
recognise it.
Yeah.
Can I go back to the actual surgery now? Because you've explained obviously how the vasculature works and the veins and the arteries and the T-junctions and the motorways. But obviously we started some of the conversation was, okay, you go in with the super glue and the coil, because this is kind of where it all was starting.
Yeah,
And you block
bit
off
scary.
and you're blocking off a blood vessel. But obviously the blood flow to the scrotum is really important. What are you blocking off? How is that not then causing more problems because you're blocking off blood flow? How does that element work? This always kind of puzzled me.
So what we didn't come up to touch on in that bit of the conversation was the backup plan. So as well as the motorway, the A roads, the T junctions, there are also multiple B roads around the testicles where there's a whole, if you like, a capillary network of small vessels that drain into the scrotal sac, so your ball sac, basically. Those veins are there. They're quiet, just sort of
Doing their own thing.
doing their
light
own
traffic,
thing.
not too busy.
Light traffic, farm vehicles only. But the point is, there are so many of them, and what we are aiming to do by blocking this main vessel is to prevent the blood being pushed backwards. Because if you think about it, if the blood is being pushed backwards, how is it draining? Well, inefficiently, because part of the kidney's blood flow is coming down into the to around the testicle. And then that blood is being drained by these B roads. So if you can stop the backflow of that blood, so less blood is anyway flowing in the wrong direction, no blood is flowing in the wrong direction, and then the testicles' blood, rather than struggling to fight its way up this one-way system, which is completely cluttered, and then hit a T-junction at the top. If you can stop that whole road and then allow the testicles' blood to drain into the scrotal, the deep scrotal veins, then you've taken away that back pressure. So what we are trying to do is not cut off all venous drainage, or you would kill your testicle.
Yeah.
What we are trying to do, what we are succeeding in doing, is stopping the backflow and allowing then the blood to drain through the scrotal sac.
So when you treat a varicocele, are you almost always going to the same point, that T-junction, to block that off? Is it almost always the same operation, or does it vary from patient to patient?
So everybody's veins are different. Everybody's veins are slightly different, but because I've been doing it so long, I know most of the variations. But for instance...
So it's a
every
variation
now
on a
and then-
theme, though, isn't it, really?
Yes,
This
very
backflow
much
from
so.
the kidney.
Yes, yeah. But sometimes you can have the blood vessel not draining into the kidney's blood vessel, but draining into branches of the back vessels, or the lumbar veins, they're called. Or sometimes it can drain directly into the inferior vena cava on both sides. Sometimes a person is born with their body inverted. So the heart is not on the left side, but on the right. The stomach, everything is turned the opposite way
Yeah,
around.
I've heard
I
this,
had
isn't
no
it?
idea that's a thing.
And that's called situs inversus. So basically everything is inverted. Just use posh words
Just
to
Latin, yeah, to make it
scare
sound.
everybody off and make us sound impressive. But the fact of the matter is everything can be reversed. And then you have to do everything as if you're looking into a mirror.
Yeah.
And then in those people, 90% of their varicoceles will be on the right side.
Of course. Yeah.
Because everything is the other way
Back
around.
to front.
But the point I was making is, because these blood vessels can come off various... So, for instance, it should join onto the kidney's blood vessel. What if you have 3 kidney blood vessels? How do you find which one it's coming off? What if it's coming off the top? So it's going upwards and then looping downwards. These are all problems which you can't anticipate. And so whenever I treat a patient, I tell them, 1% of you, I will not find your vein. It's just hidden somewhere.
So not only are you a plumber, firefighter, iceman, you're also a road technician or a roadwork engineer, because you're basically putting in a diversion, aren't you? You're like, okay, let's close this road off here and here, and all the traffic can go down these other B roads.
Yeah.
Yeah.
That's a lovely way of putting it, isn't it?
Yeah, I've got it now. I've
You've got it
absolutely
now.
got it. It's brilliant.
Firefighting
So the aim,
Iceman.
so the aim is not to get rid of all exits.
No.
If you close all exits, that's it.
Yeah.
No blood can flow in because no blood can flow out.
Yeah.
Yeah.
And that's where you'll have severe problems later on.
Brilliant.
Yeah.
But just coming back to this 1% of patients, I mentioned that, but I have a backup plan.
Mm-hmm.
We all need backup plans. So with those patients, I don't keep looking and looking and looking, because the more I look, the more x-rays we need to use.
Yeah, sure.
I know when I've looked in all the normal places and I stop there, and then I let the patient go home. I bring them back in about a week, 10 days, and I do a special mapping scan of all their veins within their abdomen. Takes about 10 minutes, 15 minutes to do that scan. That shows me all of their vessels, and then I bring them back knowing exactly where their vessel is coming off.
So that's like your sat nav.
Yeah, it's a full download of your A
It's
to
a-
Z.
Yeah, it is.
Exactly.
A to Z of your...
Yeah.
Exactly.
all your
That's
vessels.
fascinating.
So it's
Yeah.
not the memorized map anymore that I have in my head.
No.
I'm using a sat nav.
You got to
Yes,
use
you've
your GPS.
Yeah.
It's just like you're saying, getting to the studio today. It's like,
Yes,
you know,
indeed,
your
yeah.
GPS stopped working. It's like, oh my God, I haven't memorized the route.
Yeah.
Yeah.
Absolutely amazing. Now let's get into the surgery or the embolization process, because there's so many men like, oh my God, you're going to operate on my testicles. And Toby, you know, we've got
I
to
was
bring
that
obviously
guy.
your story in at some point, but
Yep.
many men think, I don't want to go for varicocele. I don't want to have somebody touching my testicles or cutting them open. You know, is it really that bad? And I think you two have got to share.
I think, do you want to speak on the is it really that bad question first?
No is the answer. So I was that guy that was I was very nervous. I came to you in the pandemic, so Katie wasn't able to come in. And I remember sitting in my room just waiting for you to arrive, and I was absolutely shitting myself, to be fair. There's no other way to put it. I'm not very good with needles. You know, I'm very kind of like, I don't like blood. So that's my like fear out there. And yeah, when we was in theatre, I remember just laying there chilling out, just in awe of what you was doing, watching all the screens and chatting to the rest of the team in the theatre, just so chilled out. And it really was that simple for me.
Well, it would have stung at the top of your leg when I gave you the local anaesthetic.
Yeah,
at
that
the
was a bit
groin.
uncomfortable, but 30 seconds of that and you're
Yeah.
back to being chilled out. I think the worst bit for me was the paint stripper thing, which we haven't got onto yet, but I think you've got an adjustment on that now. That was uncomfortable, but honestly, it was like I actually just felt so cool, calm, and collected, and just chilled out.
Well, I think
It
it's
was
the point that
easy.
actually with an embolization, as you said right near the beginning, Stephen, it's not an incision. You're not
No.
cutting open the scrotum. You're not cutting into the groin. It is just a small pinhole or needle hole to get the wires, or well, not even the cameras, because obviously the cameras are X-rays and ultrasounds over the top, aren't they? So it's literally just a wire going in like a catheter,
Yeah.
and that's it, you know, or cannula. So it's not a major bit of
Not
surgery.
a big deal.
No.
is it?
So most of us have had blood tests.
Mm.
The blood test involves passing a needle through your skin into a blood vessel, and then they get some blood out. What I do is, before I do the equivalent of the blood test, I put a tiny bleb, so a tiny injection using the equivalent of an insulin needle, which most people can barely feel. I put that just under the skin, and I put some local anesthetic. And that stings like an insect bite. Would that be fair?
Yeah,
For a few seconds. And then I rub that. Why do I do that? Takes more time, but it allows the painkiller to spread,
Disperse, yeah.
to disperse, which means it's working further. Then I put a bit more of that local anesthetic, a bit deeper, but already this local is working and it's spreading. And I keep doing that until I'm all the way to where the blood vessel is that I need to get into to do this procedure from. Once it's fully numb, then through that very same needle, I get into the blood vessel and pass a little wire and use my various catheters and whatnot. So you don't even have a cut to your skin. It is really the equivalent of having a blood test.
Yeah.
And I do them, as I was saying, through the groin, which is the crease of your hip. I do it at that level, so where your leg bends from your waist. So at no point am I poking anything around within the testicle. And this is a really important point. Any rapidly dividing cells in the body, you don't want exposed to X-rays. At no point do I take X-rays of anyone's testicles. The most imaging I do of testicles is ultrasound, which is just sound waves. And if you think about it, it's the same mode of assessment for a rapidly growing fetus is ultrasound.
Yeah. So it's
Very
incredibly safe. Yeah.
It's sound.
And when you get into the veins where you want to put the coil in or the super glue, these veins aren't in the scrotum? Are they actually slightly higher in the groin?
So if you think about, as I mentioned earlier, if you think about a tree with its roots, those roots are going down and around the testicle. What I'm trying to do is to catch those roots where they join together at the lowest part of the tree trunk. Where they join together is where I block. And in blocking them there, I haven't compromised any of those veins around the testicle. Though some of them can sometimes clot off, and that's no big deal because some of them are very large and you really don't need or want them.
Yeah.
But the important thing about that is the whole of that village, if you like, with its road network is all running. It's just the main exit road that I close to then allow the B roads to take over, the little roads around that village.
It's
around
amazing,
the
isn't it?
So
I've
cool.
never heard of it as
To take
described
over.
as
Yeah.
A roads,
Brilliant.
B roads.
And,
so
and I'm just putting myself back in that moment when I was laid on the theatre table and I was watching the screens that were my imaging of my body. And I can kind of picture this now when you put the dye through and you take a picture and you can see the kind of little maps and stuff. I kind of, as you're saying that, I'm literally visualising my own body like at
the
that moment.
A153.
I'll never forget it.
B46.
Yeah, that's it. Yeah, it just blows my mind. Just in awe of this conversation. Really, it's amazing.
So I want to ask about the blocking off. So you've mentioned coils, which is what Toby's got. You've mentioned the super glue. What are these different methods, and what does the guy feel? Because we've talked about the paint stripper medication. We talked about it on our Insta Live, and Toby's talked about it. So what are all the different methods and how?
So I only use, my method does not change. I use coils. So once I've done that road mapping, I find the place where all these vessels come together, and then I place at that point, I place some platinum coils. The aim there is to block that vessel for two reasons. The obvious one, in blocking it, you don't want blood flowing backwards. But actually, for the immediate reason, I block it and then I check that it's blocked by injecting some of that contrast medicine which shows up on my X-ray screen and seeing if the medicine goes below the coils. If that medicine doesn't go below the coils, it means that vessel is blocked where the coils are. It doesn't mean the whole vessel is blocked because there are many side branches flowing around and joining that vessel. So this is when, once I've demonstrated that the main vessel is blocked, I use the paint stripper. The medical
as we're
paint-
calling it,
That's
yes.
it. Yeah.
The medical paint stripper is sodium tetradecyl. If you look up fibrovein, Fibrovein, so it fibroses veins. If you look up fibrovein, it'll give you some information and give you lots of scary information about all the side effects, complications, etc. But the point about this medicine is that it irritates the vessel wall, and in doing so, it encourages clot to form. Now, in irritating the vessel wall, it of course stimulates the nerves all along the vessel wall, and that can cause quite a bit of pain, quite a bit of aching. It can be a combination of like a dull lower abdominal pain going to your flank. It could feel like the day after a kick in the nuts. So that dull ache, you can't quite pinpoint it, makes you feel ever so slightly nauseous, a little bit faint.
We've all been there, haven't we? Some more than others.
And if you're really unlucky, it could be both of those. So that medicine I use to block the main vessel, to fix the coils into place, and also very importantly, it spills into the little, if you like, roads that are going to join this main vessel, which joins the T-junction. If you leave those little veins, this whole process can start up again, because those veins are also, to some
Vulnerable
can
to,
also
yeah.
be incompetent, so it can allow backflow. So in injecting that medicine, I fill the vessel all the way to just below the T-junction, so it takes out all of those side branches. It blocks the main vessel. And that's why after I do the procedure, I tell patients for the next 5 days, don't do any heavy exertion. Why? Because even though I've blocked the vessel and the clot has formed within that vessel from this irritating medicine, the sclerosant, the clot is soft. So let me use another analogy. When you've cut yourself on your arm or your face, or when you've had a shaving cut, for the first while, there is not a scab. It's first just a bit of bleeding on the skin, and then it forms a very soft clot there. And if you forget and you accidentally rub it, it's gone and you start bleeding again.
Yeah.
Then after a few hours or a day or so, you have a firm scab. And then, of course, the desire is to pick it off, and then it starts bleeding again. But if you leave it alone, it just heals and the scab just gets absorbed or peels away or whatever. So that's what happens inside you. You first get a bit of blood which thickens to form a clot. That clot is soft. It's just like jelly.
Yeah.
And if you exert yourself then, say if someone kicks you in the belly, that increased abdominal pressure can push the clot out.
Yeah. Move everything that you've just done. Yeah.
So that's why I say take it easy. Now 5 days is huge overkill. Within 36 hours, the clot is set, but it is still soft. But certainly within 5 days, it's all set, it's fixed, and it will not move no matter what you do.
That's amazing, isn't it? Really? How the body
Incredible.
repairs itself.
Yeah. How do the coils work? Because when you say coil, I think of a little coiled spring. And I'm like, well, how does that block off a blood vessel?
So if you think about, and that's probably the best analogy, think about the spring in a ballpoint pen, but think of it not as firm as the spring in a ballpoint pen, but if you dropped it on a table, it wouldn't form that spring, but it would just form a loop on the table, just like string being put on a table going round and round in a little stack. So the point of the coil is it's made of platinum, but it is very floppy and it has tiny fibers on it. So it's like a rope which is fraying.
Okay.
Now, when you put that into the vessel,
It
it
encourages clotting.
follows the contour of the vessel, so it doesn't distort the vessel. And those little fibers do exactly what you said. It encourages clot to form.
It's just like how a heart attack, the coronary kind of blockage develops, isn't it? Is you get damage within the artery wall, and that encourages the platelets to come along,
Yes.
and then they just pile up,
All
and
that
then
up.
lo
And
and
they just
behold,
block it
yeah.
Yeah.
Wow.
Except we are
You're engineering
doing
that.
this.
Yeah.
Yeah.
And the aim there is to block that vessel, to block the side branches. And because I use this fibrovane medicine, I use much fewer coils, and I'll come on to various points about that. Much fewer coils just at the bottom. The whole vessel is blocked with the fibrovane. The coils have blocked the vessel at the crucial point where these vessels come together and join. But the coil prevents the medicine from going down and irritating the testicle by blocking any of the surface testicular veins. Because if you block those veins, that segment of testicle
It's done for.
can die.
Yeah.
So you're basically blocking off either end of the road, and then this fibrovane, I just imagine as napalm. You just going into napalm in between these 2 points. It's probably a bit extreme, but you're then killing off all of that bit that you've blocked off and the attaching veins. I reckon I could do it now.
Away you go. We've got a table here.
Yeah.
It's all
It's
you
like-
need.
Visual anatomy.
It's like a Haynes
Bit of
manual
light.
for varicocele. This.
That's amazing.
And what about the recovery? Because this is the other thing, isn't it? It's kind of how long will recovery? What are the complications? And what about improving sperm quality? How long is that going to take after all that?
So recovery. After the procedure, we press at the top of your leg where you've had your blood test equivalent little needle hole for 2 to 5 minutes. And then you come out of the X-ray room and you go to whichever, you're on your own bed, your own hospital bed, I should say. And we have you at about 30 degrees, so you're not lying flat. So that you can eat and drink straight away.
Then. No, 30 degrees Celsius. It's like, sorry, 30 degrees recline.
Yeah. And the point about that is, and you'll remember, I say, right, eat and drink straight away. You're probably starving, but as well as being starving, you want to wash out all these medicines that have gone in, and the body just excretes them. And the best way to do that is that you're well hydrated. And we ask you to fast beforehand, or certainly not have any big meals, because some people feel a bit faint, some people feel a bit nauseous, and we don't want you barfing when I'm halfway
That's
through
not
my
pleasant for you.
halfway through
or the
my
rest of the
operation.
team.
It just messes up the whole procedure.
Yeah.
It's a bit pongy and all the rest of it. So you eat and drink, 1 hour in bed, and then we get you up a half an hour after you're up and about. You go home.
Wow,
it's amazing, isn't it? So it's such a short time, and it's a day case, isn't it? Really,
Yes.
But the actual procedure doesn't take that long. Am I right?
We
in
set
thinking?
aside an hour. It can sometimes take less, sometimes take a bit more.
But an hour's not huge amount, taken out of somebody's day
Most
to get
patients
something
find. I
repaired.
mean, how long did yours take?
think
Yours was a
I
double.
was the complicated one, I think, wasn't I? I was one of
Because
the
you
rare.
needed both sides.
Yeah.
And
it's
you're-
always been bloody awkward. Isn't
Yeah, it's a common theme, isn't it?
It's part of that 5% or whatever it was.
But even then, I mean, do you remember how long your whole thing was?
It was definitely over an hour. I think it was a little bit longer than what you had planned when we spoke, but I think that's just because I was a bit of a complicated case than
Yeah,
you
but
normally
also
get,
you had both sides.
yeah,
So that doubles everything straight away.
but it didn't feel that long, and the recovery was fine. Like I was up within an hour. I was uncomfortable for a couple of days. I remember feeling quite achy for a couple of days, but after that I felt like a new man. It was really, really unusual actually.
Yeah.
Kind of I think I texted you, I think it was, or I called you, but I remember speaking to you saying like I felt like I got a new pair of balls. It was like this weight had kind of disappeared and gave me a spring in my step, to be fair. It was really nice to go running and like not have the discomfort of that achy kind of testicles. So for me that was like a big change instantly almost.
But I think you've said before that it wasn't something you were aware of, and it didn't really bother you that much until it was repaired. And then you're like, oh, actually.
Yeah, I mean, I was aware of having like aches and dull aches, and there were certainly a couple of occasions like through intercourse, so I definitely had an ache afterwards, and but I've had that for so long, so I just thought that was just normal. And of course, I didn't speak to my friends about it. Didn't really speak to you guys about it, to be fair, and I just thought that was just normal. That's just what guys get. And of course, as soon as the surgery and the recovery had happened, and like I did the tasks that I would have done before when I had these kind of issues, it was like, oh my God, this feels amazing. Like it just feels so much lighter and better. And I guess you kind of just learn just to kind of cope with what your body's dealing with. So those aches were just kind of like my baseline, I guess.
This is a bit like boiling a frog, isn't it? You stick it in cold water and turn the temperature up. So the story goes that it doesn't
you tried
notice.
it, have you?
No, I haven't tried it. Poor frogs.
Poor frog. No frogs are harmed. on
But you
this
don't
podcast.
notice minuscule changes, do you? Whereas, and like you said, varicocele 1 mil per decade, it's going to be a very slow, gradual kind of change, and you might just think, oh, it's just an age thing. I'm getting a bit older. I'm getting get a bit of heaviness or a bit of achiness. It's very gradual. Whereas, I don't know, maybe you break your arm, like, oh, okay, that's definitely a major change. Yeah.
That hurts.
And you asked me about
Changes.
what happens after. So the 1 hour in bed, half an hour up and about, and then I tell patients to take paracetamol regularly because it is quite likely going to be achy. So that medicine I use is a sclerosant. It's supposed to inflame excuse me, the main vessel as well as any side branches. Now, inflammation is painful.
Yeah.
So I tell patients to use paracetamol, take it regularly for the first 3 to 5 days. And if by day 3 you're still quite uncomfortable on the paracetamol, to add in an anti-inflammatory like Nurofen, ibuprofen or something like that. Why? Because that inflammatory process, which was necessary, has done its work.
Yeah.
And by about 36 hours, all that you're left with is ongoing inflammation when you don't need it anymore, because it's already inflamed the area and blocked everything off. So then you can take an anti-inflammatory. But what you don't want to do is to take the anti-inflammatory on the same night, because it's still doing its job.
Yeah.
So that's why I tell patients, for the first 24, 36 hours, just take paracetamol. And then if you need to, and if you're still sore, which you may well be, add in some anti-inflammatory.
That's quite important to know, isn't it, really? So you want painkilling activity just post-surgery, but then, 4 or 5 days afterwards, you want the anti-inflammatory if the symptoms still persist.
Most people don't have that.
No,
because it's all damped down and it's already getting better, but some do. And part of that anti-inflammatory effect can be also close to or around the testicle, because you get that aching, and you can get a reactive hydrocele, which is fluid around the testicle. You can get, these are not common, but they are well known. You can get what's called an epididymitis. So the epididymis, if you like, is the storage sac of the sperm once it has been developed and released from the testicle. So that can get a bit inflamed, and indeed your testicle can get a bit inflamed. That's called an orchitis. All of these things are helped by the anti-inflammatory. So even though they're rare, they're not. They don't surprise me if they happen, and they need to be treated. It's not a big disaster, and it's not that everything has failed. It's just you're very sensitive.
It's a sensitive, and it's just a slight complication of the intervention.
It's one of the effects.
And then in terms of sperm recovery, we typically would say about 3 months, but maybe it might be a bit longer.
Life cycle of sperm is 90 to 100 days, 3 months.
Yeah.
So any sperm that is already being developed from the earliest to the latest phases will already have had the effect of the heat. So the next cohort, if you like, starts, the clock starts after the procedure, the temperature falls. And so 3 months.
You're starting to get the good stuff, the better stuff.
And most people say if you're going to have IVF or any harvesting such like, leave it for 4 months. Now you'll get a continued improvement, and it can continue. So the initial improvement, you've got quite a steep curve of improvement, and then it plateaus, but it continues to improve. And that improvement can continue, albeit minimally, to reach the final plateau, and that could be 9 months to a year. But the big improvement is within those first few months.
Certainly was for you, wasn't it?
It really was. Yeah, it really was. Yeah, 3 months later, we had spontaneous pregnancy, which still blows my mind. I feel quite emotional sat with you today, just because of that reason. Every time I'm
changed
with
his
you,
life.
Quite frankly, changed my life. That surgery. I did a YouTube video actually in the hospital bed, and actually I think it's the last YouTube video I've done of my kind of like fertility journey. I've kind of been a bit busy since then, but I remember documenting how emotional I felt that actually the varicocele surgery that I had, the embolization that I had, was. Could it be it? I left the question, could this be all we needed? And little did I know that in 3 months' time that we would have that spontaneous pregnancy and our lives change forever. And, I encourage that for anyone that's got a lump to get checked out, get tested, have a DNA fragmentation test. But I kind of want to put it back a bit about what you said earlier about kind of making the best ingredients possible for a good, healthy baby. I think as patients, we get so hung up through this process that you're just desperate to get pregnant, let alone even having a baby at the end. You're just desperate to have a pregnancy. When you get pregnant, you're desperate to then have a baby at the end. You actually forget about, I want a good, healthy baby. And these kind of procedures and doing the diagnostics and understanding actually how good is the DNA of my sperm, and if we can help improve it, then when you do get pregnant, at least then you're going to give yourself the best possible chances of a healthy baby, right? And that's ultimately the goal here, isn't it?
Yeah. So I'm not keen on treating for treatment's sake.
Yep.
I won't treat somebody who has no symptoms and is not concerned with, infertility.
Mm-hmm.
It would be very easy to do, and it's not right for me. It's not right for me.
Yeah.
It's part of the way I practice medicine. I work with some very strict personal rules. Just because I can fix something doesn't mean it needs to be fixed.
Absolutely.
And that brings us to the point that you raised about the DNA fragmentation, the examination by the andrologist, the assessment of all other factors. I mean, it may be that you're just, I don't know, drinking too much alcohol and smoking so
Diet
much.
and lifestyle's
Yeah.
massive.
You know?
Yeah, always do that anyway. Yeah, tidy
Yeah.
that up.
So why fix the most trivial bit of the problem, which could end up as being the most expensive bit as well? Because none of this is cheap. But then having children
It's not cheap
is not,
either. No.
is not cheap. And I'm not trying to downplay
No.
the point, but I wouldn't encourage it to be done unless it's very clear that you're going to benefit from it. And that brings me to the next point, which we were touching upon, which is the complications, which you asked me about. No procedure is complication free, but I am very aware that people who are coming to see me for the treatment of their varicocele are well people. So the bar is way higher. So I was mentioning about some of the other procedures I do, somebody dying because of bleeding. The bar is way down. If I can get that person to not die, I have succeeded.
Yeah. Yeah.
That cannot be the bar when it comes to a varicocele. When you come to me and I say, as long as at the end of this procedure you haven't died, we have been successful, is not a good advert.
No,
for
it's not.
varicocele
It isn't.
treatments.
It isn't. Not at all.
So what am I trying to achieve here? I'm trying to achieve as an improvement to a well person, and at the same time them preserving their wellness.
Yeah.
Very different.
That's really interesting. Yeah, yeah.
So I have three jobs. Number one, to do my procedure. Number two, to keep you safe, to make sure you are well throughout the procedure and after the procedure. And number three, to keep you comfortable. So it's not the most traumatic, or indeed in the top 20 traumatic things you've been through in your life. Now, one of the things which many patients found to be very traumatic was when I used the fibrovein, because it is an irritant. The intention is to irritate the vessel. But of course, it fires off all those nerves. And those nerves are pain nerves, basically, which means everything's been great up to this point. And I say, right, I'm now going to give you some medicine, and you could get quite a bit of pain.
Discomfort. Yeah.
I smile as you say that because I remember this bit well.
Yeah.
No pain, no gain. in
That's
this
right.
method.
And that is such a glib comment when you're on the blunt side of the needle,
Yeah.
which I mostly am. So I was thinking about how I could make this less. And I was speaking to some of my anesthetic colleagues who are experts at the management of pain. And they said, often before we give the strong sedative anesthetic medicines, which sting the veins, we put in a little bit of anesthetic into the vein, which numbs the inside of the vein. And that has been one of the biggest. I'm so sorry, Toby. It happened after.
okay, Steve.
It happened after, but it's one of the biggest changes to my practice in the last 7 years, 10 years, because everything else, I don't know what else I can do to tweak it to make it less. But that's the one thing that I did do. Put a little bit of anesthetic so it hurts less.
But that's amazing, though, because that is just continuous improvement
Yeah.
by thinking, what else can I do? And, searching that research,
Yeah.
searching the knowledge with other colleagues to say, how can I do exactly what I want to do, but do it slightly better?
Now, let
And
me
that's
very
brilliant.
importantly speak about some of these complications. I've already mentioned about orchitis, the inflammation around, and the hydrocele, which is fluid around, which is a sign of inflammation. You can sometimes get clotting of some of the veins around the testicle itself. For me, that is not a complication. Those veins were excess, and you didn't need them. And that, though, makes the testicle feel even bigger and more lumpy, because a squishy vein compared to a clotted vein always feels bigger. Sorry, the other way around. A clotted vein always feels bigger than a squishy vein. So you think, this is worse than before. And then the body absorbs those veins, and that takes months. It's not a quick process. It's like when you get a black eye. 6 weeks later, it's starting to fade. And these are micron depth of blood under the eyelid, as opposed to a 4 or 5 millimeter vessel that is being absorbed. The other risks, when you look online, damage to the testicle, I've told you how I minimize that by not letting this medicine go down to the testicle, not going all the way down to the testicle at any point, so no x-rays of the testicle. Coils moving, you see that a lot now by fixing the coils, as I do with the medicine above, and plugging them into the lower part of that vessel, and you taking it easy for the next 5 days. I've never had coils move. And then I inject contrast medicine into the vessel to map it properly, so that I don't even take the coils off the shelf until I'm in the right vessel. And that
exactly
sounds obvious,
Yeah.
but you can sometimes put the coil in the wrong place. If they do go in the wrong place, they cause the same effect, but in the wrong part of the body. So you could block off the kidney if you put it in the kidney's blood vessel. Or the other thing is, if they're put in such a way that they can move, they can shoot off, block the kidney's blood vessel, go off into the lungs, cause various problems in that way. So the way I do it hugely reduces those things happening. And those really are the risks.
Yeah, you're minimizing those risks all the time, though, by the sounds of it. So
This has been a fascinating conversation, so much better than I thought it was going to be. And I thought it was going to be amazing anyway, and must have been brilliant for you, Toby, having
I've
been through it.
Just in awe of this.
But we kind of need to draw it to a close, because otherwise we'll be here all day. Stephen, this has been absolutely fantastic. Thank you so much. And I think there's going to be a lot of men that will listen to this and get a lot of reassurance that you're an outstanding clinician who really cares about what you do and does it to the highest standards, but also just demystifies varicocele and treatment. So that's just brilliant. How do people find you? Because you work privately and you also take NHS referrals, don't you? Is that right?
So I'm now based at Watford, because I live locally. I live in Watford. So that's where my NHS practice is. Like every NHS, it struggles with providing services for infertility. There is not a hospital that isn't sort of on its knees. I also do it. I do these privately, and you can find me. I should have known this. Varicocele UK.
We'll link it.
Steven Moser and Varicocele UK, and that gives you a bit of information. And from our previous talk on
Instagram,
on Instagram, that gives a fair bit of information as well.
Some good resource there.
A lot of this, and I think on that Varicocele UK, you can tell I'm a Luddite. I work with very high tech medical equipment, but I need my kids to help me with
social media.
No, just with the working of my phone. It's, as you mentioned, my GPS failed on my way here, and I couldn't make it work. But fortunately, I'm used to memorizing routes, so we got here okay. So on that Instagram account, there is a brief version of what I've explained as well here.
Yeah.
Brilliant. We can share that in the show notes below.
We'll link all of that in the show notes. Thank you again so much for taking your time out of your day and coming to join us.
I look forward to doing this again. We can discuss pizzas next time.
We miss pizzas.
Absolutely. We have missed the very important part. It is very important.
But thank you all for listening and tuning in. Remember, we talked about undercentered testicles. That's an important question on our free questionnaire, so go and check that out because it's a risk factor for fertility. We've got the testicular ultrasound service that we've partnered with Ultrasound Direct. So actually, if you're concerned, you've got any lumps or bumps or it feels like you've got a bag of worms, just book yourself in for a testicular scan. It's nothing to worry about. A bit of cold gel and that's it. But thank you again, Stephen.
Yeah, Stephen, thank you for everything
Delighted
you do.
to be here.
You are changing lives for the better. So thank you
you're
so
very
much for your
kind.
work.
You're very kind.
Brilliant.
Thank you.
Cheers. Bye-bye.
Okay.